I am Dr. Suraj Tantak, MBBS, DNB Medicine, consulting physician practicing at Pandharpur, Maharashtra. Today, we will be discussing about diabetic gastroparesis and gastroesophageal reflux diseases, understanding the overlap and the path to comfort. Gastroparesis is also known as stomach paralysis, is a condition where nerves and muscles in the stomach do not work properly. This stops the muscles from moving food through the stomach into the small intestine. When this happens, food does not move or digest the way it should. People with gastroparesis may feel discomfort while digesting food and experience long lasting problems like low appetite, difficulty in getting enough nutrition, trouble getting managing the blood sugar, and sometimes food may stay in the stomach and no move and do not move through it the completely. In patients with diabetes, high blood sugar, and for long time damages the vagus nerve, the nerve that controls the movement of food through the digestive system. This results in slower movement of the food in the stomach or restriction of the movement of the food in the stomach. This condition is called as diabetic gastroparesis. Gastroparesis and gastroesophageal reflux disease, that is GERD, are connected in many ways. When food stays in the stomach for longer time due to gastroparesis, it increases the chance that food and acid will flow back into the esophagus, causing GERD. In addition, due to the accumulation of food and liquid in the stomach for longer time, there is an increase in pressure between the stomach and the esophagus. The amount of food and liquid in the stomach and volume of stomach contents that could flow back up instead of going forward, it will flow back up in the esophagus. Also, it can cause an increase in the stomach acid production. Another important connection between GERD and gastroparesis is the stomach swelling, which happens when food takes too long to leave the stomach. This swelling can cause the lower esophageal sphincter, a muscle at the bottom of esophagus, which opens to let to another important connection between GRD and gastroparesis is stomach swelling, which happens when food takes too long to leave the stomach. This swelling can cause the lower esophageal sphincter, a muscle that what is the lower esophageal sphincter? It is a muscle at the bottom of esophagus which opens to let the food into stomach and closes to prevent the stomach acid and food from moving back up to the esophagus. That to remain open and leading to gastric acid reflux. If patient with GERD experiences heartburn along with other symptoms like feeling full quickly, nausea, vomiting, it could be a sign that they might also have gastroparesis. There are some simple steps that patients suffering from gastroparesis and GERD can follow to manage their symptoms. Drink enough amount of water or fluids. This will prevent you from dehydration, which may in turn cause nausea. For adults, around 1.5 to 2.5 liter per day of water is recommended. Eat your meal in small portions. As larger meals are difficult to digest, frequent small meals of 5 to 6 times per day are easier to digest and would lead to fewer symptoms. Eat foods rich in nutrients based on how your body can digest it. Some patients can have solids with the earlier part of the body without any symptoms. So, for them, having solid food earlier in the day followed by light or liquid foods at night may help to manage the symptoms. If small proportion of food or solid food intake is unable to improve your symptoms, you can follow a liquid or semi-solid diet. Reduce the intake of food containing fibers as it slows the progress of stomach emptying. These foods can also form a bezoar in your stomach. A bezoar, what is bezoar? Bezoar is a mixture of foods and fiber containing foods that leads to blockage in your stomach and does not allow emptying of the stomach contents. Reduce the intake of foods containing high amounts of fats. Food labeled as low fat, non-fat or fat-free can be eaten as fats are responsible for slowing and emptying of the stomach contents. Again, before gulping down your food, Chew it very well. Similar to the consistency of mashed potato, you can make liquid puree of your food if needed. Sit upright while eating and after finishing your meal. Monitor your blood sugar regularly and maintain it within the normal range, as this may help to improve your symptoms. Avoid consuming alcohol as it also affects the emptying of stomach contents. Exercise regularly as it will help you to improve the symptoms of gastroparesis by increasing the speed of emptying the stomach contents. Usually, walking is enough and is recommended. If you are experiencing symptoms such as feeling full quickly, nausea, vomiting, along with the heartburn and acid reflux, consult your doctor. In case you are diagnosed with gastroparesis, following these steps we discussed earlier may help to manage your symptoms of gastroparesis as well as gastroesophageal reflux diseases. Thank you.